I'm very excited to have Leslie Pagel joining us today. She is the chief evangelist of Authentics. Really cool. Authentics is a conversational AI company, and they're actually dedicated to improving the way healthcare companies engage with patients. So I was really curious to have Leslie join us for a discussion about technology and how AI could actually help healthcare professionals possibly choose their words more wisely. That's something that really we care a lot about on this show. So, Leslie, before we jump into that discussion, please just introduce yourself and tell us a little bit about your professional background.
Awesome. Well, thank you so much for having me on the show. This topic of being really intentional with the words and the tone in which we express ourselves is such an important topic. So thank you for highlighting that and for bringing it to the audience. My name's Leslie Pagel. I've spent over 25 years in the world of customer experience strategy. And for about 23 of those years, I have spent working with large organizations, healthcare organizations, on keeping their finger on the pulse of their customers. And this authentic voice of the customer happens in conversations when customers call or chat or email with an organization. These conversations historically have been recorded, and they've just sat dormant. And through the work that Authentics is doing, we're helping healthcare organizations unlock this data source so that healthcare organizations can not only just improve their relationships with their customers, whether that's patients, caregivers, doctors, pharmacists, payers, but also improve health outcomes for people like you and me.
And Leslie, let me ask you about how proactively in the moment healthcare workers can kind of better choose their words more wisely and provide a better kind of bedside manner. In that moment, how can AI and technology in general help that process?
Yeah. I would say it goes beyond just the frontline staff as well. The nurses, the frontline. It's also how marketing can choose its words wisely, how administrators can choose their words wisely as well. But it all starts with listening and really being open, having a mindset of being open to truly listening to the voice of the customer and the voice of our folks. So the data set that we use is recorded conversations. Often they're calls into a contact center. So for a hospital system, it would be when someone calls to schedule an appointment, or when they call and interact with the nurses to ask about their symptoms, or to ask about their treatment plan. Or perhaps it's when they're calling or chatting related to their bill. And so what happens is when you leverage conversational AI, you can study those conversations. And when we study those conversations, we look at both sides of it. We look at the customer and what they're saying, and we look at the team member and what they're saying. And we can start to identify patterns of, okay, a customer is really asking about this. Here are 4 different ways that our frontline responds to it. This way, where we take ownership of the issue, we show perspective that we're hearing them, they've been heard, we take ownership, ends with a higher sentiment. It ends with less burden on the customer. It ends with improved access to care. I mean, it really depends on the problem that the business is focused on solving. But it's an example of how, when you listen to both sides of the conversation, you could start to understand, what are customers asking about? Why are they asking about it? And how are we responding and which response yields a better outcome for the customer? And so then you could start to look to scale that type of response. Scaling, we call it, one example is what we call demonstrating perspective. This is a little bit about empathy, but it's really about showing the customer that they have been heard. And so we can take conversations and take them to nurses. We can take them to marketing. We can take them to digital and use examples of language that is demonstrating we hear you, or we understand that your type of problem. We understand what you're looking for. And so we're going to develop our website to navigate in a way in which we've heard you want to navigate. Does that make sense?
Definitely. And I'm just thinking about the patient's perspective right now. What would you say to them if there is that initial fear or just that kind of like visceral reaction that the insertion of AI in general, AI tools in general, in the patient experience could kind of make things feel less human and just kind of lose that human touch? Like, what would you say to the patient?
Yeah. Well, it's a hard question to answer because AI is such a big thing. And so it really is about how AI is being leveraged.
Yeah.
That makes the difference for me personally. So for me personally, I am not interested in interacting with a robot. I am interested in interacting with a human being. That's me. Other people are very much inclined to go online, to open up a chat bot and interact. And it is a very effective way of getting answers to routine, simple questions. Yes. Is it my preference? No. But that's not like the AI that I'm talking about to help companies use their words wisely is not at all the robot, the chat bot. That's not what I'm talking about. It's not about looking to replace or assist a human in a conversation. What I'm talking about is studying, it's the analysis of conversations for purposes of truly understanding what customers are going through when they navigate healthcare and using that understanding to guide strategic decisions in the business.
That is exactly what I was thinking about, because I think a lot of what patients and just the general public thinks of maybe when they hear the word AI is it's like a chat bot. And that's because probably the most popular tool right now in AI is a chat bot. So yeah, I think what you're saying in, hop in if I'm missing the mark, is that if you hear the words as a patient, AI, or this is AI enhanced or in some way, that you have to kind of get through that initial thought process that this is going to be a non-human experience and kind of dig a little bit deeper as to what the specific tool is, because not all AI is a chatbot, which just kind of right now where we're at with AI and how the mainstream, people kind of use it, it feels like AI equals like chatbots, but that's not the case.
Exactly. And I would add on to that the other kind of common underlying, like what's underneath the surface when someone hears AI and they respond, is this like feeling that it's going to take everyone's jobs. And we see that a lot. We work largely within operation groups, and within their group, they have a team that's responsible for quality assurance of the interactions. They're very much focused on making sure that the front line is doing what they're supposed to be doing. And they're scared that conversational AI is going to take their jobs. And it's like, no, what it's going to do is it's going to enhance your job. Your job is going to become more important because conversational AI is going to drive efficiency with the simple tasks of a QA person. And it's going to allow you as a QA person to focus on the more complex customer interactions. It's going to allow you to listen more closely to the customer side of the conversation, not just the associate side of the conversation. And so now we see QA departments not just being about quality assurance, but they're becoming customer advocates for the business because they're starting to see micro and macro themes by listening to the customer side of a conversation. So I just add that because it's this, yeah, you're right. It's like, oh, we're dehumanizing with the chat bots and things like that. And we're also going to replace a bunch of jobs. And that's not at all what we're seeing from our vantage point.
Well, that is certainly a good news and some good signs there. Leslie Pagel has been our guest today on Healthcare Experience Matters. She is the chief evangelist for Authentics, talking about how AI can ultimately perhaps improve the patient experience. And I just want to thank her for her time today.
Thank you.